my name is Amelia. I'm a public health educator at MaineGeneral Medical Center. This presentation will cover basic information on condom use. So, what are condoms used for? It's almost common knowledge that condoms are thin plastic, almost pouches used during sexual acts to reduce the spread of sexually transmitted infections and to reduce the risk of pregnancy when male ejaculation occurs. Sexually transmitted infections include chlamydia, gonorrhea, HIV, herpes, syphilis, and many more. Using a condom every time you engage in a sexual act, whether it is male-to-male intercourse, male-to-female sexual intercourse, or any type of oral sex that involves a penis, it's critical to reduce the spread of sexually transmitted infections. However, sexually transmitted infections are incredibly common in the United States and globally, so safe practices either aren't working or aren't being used. Sexually transmitted infections can be lifelong illnesses, and many types of infections can cause serious illnesses if untreated, including infertility. Therefore, it is critical to prevent getting sexually transmitted infections in the first place. A question: can you get a vaccine for any of the STIs? Hepatitis B and HPV have vaccines. Unfortunately, these are the only two STIs that have a vaccine at all. True or false? Besides condoms, there are many forms of birth control. True. There are many forms of birth control. The most effective forms are the implant and the IUD. There are also several types of daily pills, monthly patches, the ring, and some less used forms of birth control like spermicide, the cervical cap, diaphragm, and emergency contraceptives like the morning after pill. There are pros and cons for each type of birth control. It is recommended that you use condoms and another form of birth control because no one type of birth control is 100% effective. Out of all these types of birth control, how many types of birth control protect against sexually transmitted infections? Only 2 types of birth control protect against STIs. The male condom and the female condom are the only 2 that provide a barrier between sexual fluids and reduce the risk of spreading sexually transmitted infections. So, we've mentioned that condoms reduce the risk of spreading sexually transmitted infections. Will condoms always protect against STIs? So condoms do not protect against all STIs. They provide greater protection against STIs that are transmitted only by genital fluids like gonorrhea, chlamydia, and HIV. They do not provide as good a protection against infections that are transmitted by skin-to-skin contact, like genital herpes, HPV, or syphilis. Condoms are not always effective. Male condoms have a 13% user failure rate. And an important reminder, use latex or polyurethane condoms because condoms made out of sheepskin or lambskin do not protect against sexually transmitted infections because these condoms have holes large enough for bacteria to go through. So condoms are not perfect at preventing pregnancy or sexually transmitted infections. However, using condoms correctly is the best way to hopefully prevent the spread of sexually transmitted infections if you are sexually active. The best way to prevent getting or giving STIs is to do a couple things at once. So use condoms every time you have sex, have fewer or one sexual partner, and get tested from your doctor annually to make sure that if you do get an STI, it's able to be treated very quickly. Condoms are available at many locations. At MaineGeneral's Harm Reduction Program, we supply free condoms. Please call 872-4102